Concept of clearance. Definition. Clearance of a substance is defined as the volume of plasma cleared of that substance or free of that substance in unit time. Units of clearance is volume per time or milliliter per minute. Clearance is a very common tool to evaluate the kidney function in kidney diseases, chronic uncontrolled diabetes, etc. It is used as a method of estimation of glomerular filtration rate, GFR, and renal plasma flow, RPF. Formula for clearance. To calculate the renal clearance of a substance X, CLX, the formula is CLX is equal to UX multiplied by V by PLX, where UX is the urinary concentration of X, V is the rate of urine flow, PLX is the plasma concentration of X. Inulin clearance for measurement of GFR. GFR is the rate at which an ultrafiltrate of plasma is formed in unit time. Inulin, a polymer of fructose, has a molecular weight of 5,200. It is a substance that is freely filtered. Inulin is not reabsorbed, secreted, synthesized, metabolized, or stored by the kidneys. Since the amount of inulin filtered is equal to amount of inulin excreted in urine, clearance of inulin, therefore, is used to measure the GFR. Inulin clearance is most accurate for the measurement of GFR. Inulin is the gold standard for GFR estimation. In clinical practice, though, creatinine clearance is preferred over inulin clearance to measure GFR. In order to measure inulin clearance, a loading dose of inulin is given, followed by a continuous intravenous infusion to keep the arterial levels constant, making it a cumbersome procedure. Creatinine clearance. Clearance of creatinine can also be used to measure GFR. Creatinine is freely filtered, not reabsorbed, and slightly secreted in proximal convoluted tubule. Creatinine clearance will, therefore, be slightly higher than inulin. In spite of this, creatinine clearance is preferred over inulin clearance since creatinine is a completely endogenous substance. Creatinine is produced by creatine phosphate metabolism in muscle. Measurement of creatinine just requires venous blood and urine samples. While measuring creatinine clearance, one should take into account if person has muscle disease or damage or has taken large quantities of meat in meal. Measurement of creatinine clearance. Analysis of the concept of clearance. For any substance X that is freely filtered at the glomerulus, how can you say whether a substance has been reabsorbed or secreted? If filtration is greater than excretion, then there is net reabsorption of X. If excretion is greater than filtration, then there is net secretion of X. If filtration and excretion rate are the same, then X passes through the nephron without net reabsorption or secretion. If clearance of X is less than inulin clearance, then there is net reabsorption of X. If clearance of X is greater than inulin, then there is net secretion of X. If clearance of X is equal to inulin clearance, then X is not reabsorbed or secreted. PAH clearance for assessment of renal plasma flow. Para-aminohippuric acid clearance for measurement of renal plasma flow. Renal plasma flow can be measured by infusing p-aminohippuric acid, PAH, and determining its urine and plasma concentrations. PAH in low concentration is freely filtered and completely secreted in the PCT. Clearance of p-aminohippuric acid, PAH, measures the effective renal plasma flow, ERPF, and not the actual renal plasma flow. This is because PAH has an extraction ratio. A small fraction of the RPF serves kidney tissue that is not involved in filtration and secretion of PAH, example renal capsule, adipose tissue. PAH will not be extracted from this portion of the RPF and will be returned to the renal vein. Extraction ratio is equal to arterial concentration minus venous concentration by arterial concentration. For PAH, the extraction ratio is 0.9. An extraction ratio of 0.9 means that the kidney is able to excrete 90% of the PAH in a single circulation. In other words, 10% of renal artery blood goes to those areas which do not participate in filtration. Normal ERPF is 630 milliliter per minute. ERPF can be used to determine the actual renal plasma flow. From the renal plasma flow, the renal blood flow can be calculated by dividing RPF by 1 minus the hematocrit. What happens if PAH is given at a high concentration? Clearance of PAH at low concentration gives the value of ERPF. This is because PAH at low concentration is freely filtered and completely secreted. As the plasma level of PAH increases, the filtered load of PAH also increases. Filtered load is equal to plasma concentration multiplied by GFR. Secretion of PAH increases with increase in plasma concentration of PAH, but only till it reaches the transport maxima. Secretion of PAH is carrier-mediated, and all carrier-mediated secretions have a transport maxima or Tm. The Tm for PAH is 80 mg per minute. When plasma PAH is low, clearance of PAH is high, but as plasma PAH raises, its clearance decreases progressively. At high plasma PAH, clearance of PAH gives a falsely low value for ERPF. At progressively higher concentrations of PAH, clearance of PAH eventually approaches the clearance of inulin. This is because the amount of PAH secreted becomes a smaller and smaller fraction of the total amount excreted.